Hey everyone, welcome back to my channel, and if you are new here, I am Mariana and I interview the brightest minds of physical therapy. So if you want to increase your knowledge, start right now by subscribing to this channel, clicking on the bell so you don't miss anything, give us a thumbs up and share with your friends. Today, our guest is Dr. Stefan Zavalin, and he is going to talk about nutrition and physical therapy. Stefan is a physical therapist and the founder of Love to Move. I hope you enjoy the show.
PT Pro Talk podcast is only possible with the support of the forward-looking and innovative company Rangemaster, the most trusted brand for shoulder therapy tools. Available now on Amazon. Hi, Dr. Stefan. Welcome to PT Pro Talk. How are you today?
I am doing fantastic. I've had a very restful couple of weeks, so I'm excited to get back at it.
Awesome. So let's jump right in. Tell us a little bit about yourself, your career, and how did you get to where you are right now?
Sure. So in general, I, in undergrad, had no idea what in the world physical therapy was. I didn't even know it existed or anything like that. And I was in kinesiology, and my parents said, hey, you should look into a grad school. So I said, well, okay, I'm really running out of time here. I got to finish in 4 years. What in the world am I going to do? And found out that with kinesiology, you really do occupational therapy or physical therapy, it seemed. And when I found physical therapy, I fell in love with it. I thought, you get paid to do this? This is amazing. Definitely, I love it. Let's do it. And I actually shadowed with this Puerto Rican physical therapist who she always called me Estefano, which was glorious. And I loved that consistently. But got into PT school. And I went to Arcadia University, which is a very homey school. They very much treat their PT program as a family, and you feel it immediately. Loved that. I unfortunately got a parasite the first semester, and I ended up going, long story short, blind throughout the process of PT school. And that led up to me really getting heavily into manual therapy, because when you're blind, it's easy to do manual therapy. You feel everything a lot easier. And that really kind of opened me more up to sort of the Maitland side of things, but really just looking out and finding and searching what more is there to do in physical therapy besides just, hey, tell people to do 3 sets of 10 of exercise of knee extensions with little ankle weights. Like, what more can we do? And our program was really good about that, of really incorporating all these things. And then got into the clinic, started actually first in a skilled care and nursing facility and a long-term care facility. And that was interesting, but I also found out that I was probably the most up-to-date clinician there by far. And I was teaching most of the people there, which I thought, I'm a new grad. This is not right. This should not be like this. I should be the one taught and learning from people. So I found a different place, and they were really heavy into manual, and they were really heavy into teaching their clinicians. And that was fantastic. Really honed in my skills as far as manual. And then come the beginning of this year, the whole vision aspect of things made me despise documentation. And I know by far I'm not alone. Even all the seeing patients or therapists don't like documentation. It's not the favorite part of clinicians, I feel. And inevitably, I just said, I think I'm done with clinical physical therapy. And I started my own business of more of a consulting side of helping companies and desk workers get a little bit more movement and reduce the amount of sitting. So it's a little bit of ergonomics. It's a little bit of PT. It's all these sorts of things, but it's not billed as PT. So this has led me now to working on a book and doing a TED Talk. So that's been the whole trajectory of it all.
That's very interesting. And I feel like many PTs are shifting. And I feel like since the pandemic happened, a lot of things changed and people were kind of questioning themselves and what is my purpose, what I really want to do. And so it's been a year full of changes and challenges and taking people to different paths. So that's very interesting. And today we're going to talk more about nutrition. PT and nutrition. So that's a topic that I haven't talked here on the podcast before. So I'm excited to see where that's going to go. And so let's start talking about where do various agencies stand on allowing PTs to discuss nutrition?
So even as a student, and for a long time, I've just been a fan of nutrition, and I love nutrition. And I think it's something that everybody needs to know, and we as PTs, why in the world would we even talk about nutrition on this podcast, is that nutrition fuels our bodies. So I've heard therapists talk about various little things, but it felt that everybody always, they would say a little bit and then they get withdrawn because they don't know what they can say and what they can't say. So in November of 2017, so 4 years ago, the APTA said that their stance is that nutrition is within the scope of practice of physical therapists. So that's where the APTA stands. However, there was the caveat of where they said, look into your state's Practice Act and see what the Practice Act says. I'm not going to go through all 50 states, but we'll talk about Tennessee, given that's where we are. And Tennessee basically says that nutrition and diet, in quotations, are not mentioned in the Practice Act. So it doesn't say that we cannot say that. It also doesn't mention it for physicians, dentists, chiropractors, or nurses. So we would expect that a physician, sometimes we say, yeah, go talk to your doctor about it. That also doesn't set it in their act. So by all intents and purposes, it seems that it doesn't disallow us to do that. On top of this, the Center for Nutrition Advocacy essentially says that nutrition isn't one sort of profession's tool set. It is across all professions, and you can basically use it to give good patient care. So they effectively allow us to do it. The bottom line of all of that is you can talk about nutrition as long as you do not label yourself as a dietitian, because we are not, and as long as you do not specifically bill for diet purposes. What does that mean? Because that's the gray area that people can sometimes get into. We bill for education all the time. Education is definitely something that you can do for patients. What is the purpose of your giving them nutritional advice? If you're saying, hey, I'm trying to give them advice to help them lose weight because they have bilateral knee arthritis, and we know that losing weight is greatly going to reduce their pain. Perfect. That you have a diagnosis that PT is meant to treat, and you're helping them improve that diagnosis. That works. Now, if you're just saying, hey, I saw this great diet and you should try out this diet, no, that doesn't necessarily mean that. But as long as you're not billing for diet, you can absolutely talk about it. That's sort of the bottom line. If you are in a different state than Tennessee, check your Practice Act, but most of the time it's just completely left out.
So I think you just answered the next question. How can we discuss nutrition without getting in trouble? So not billing, as you just said, and using to implement in our diagnosis. Anything else that you want to add to that?
Sure. And I'll do more of how you would specifically talk to patients about nutrition. But this isn't always true. But generally, if you're getting way into the numbers about nutrition, like if you're giving out diet plans and meal plans and these kinds of things, you're probably going a little too far. It's great to give these general guidelines. And there will be some numbers. We'll talk about some post-surgical numbers that you might want to use for nutrition. But in general, if you're discussing numbers like how much magnesium they need or anything like that, maybe you're going too far, but that's at your own discretion at that point.
Okay. And what are the current trends?
So these won't surprise most people. I think a lot of us know that in general, we are over-consuming calories as a nation. And these are US trends, but overconsumption of calories, overconsumption of protein and fat, specifically saturated fat, generally an underconsumption of fiber for us, as far as it seems. And so water, definitely people in general are not consuming water. We're not going to touch too much on water. I think most PTs do a great job about recommending water and telling people to drink water, but we'll talk about it a little bit. But those seem to be the general trends. And so in general, not surprisingly, fruits and vegetables are not being eaten quite as much. There was an interesting study in terms of the fiber. So we know that we've been under consuming fiber for a while, and patients were being told this, and various study subjects were being told this. And over a decade of being told this, the amount of fiber they consumed didn't change. So that's another kind of issue of, yes, we're telling people this. Yes, the information and knowledge is out there, but it's not being incorporated appropriately. That is a lot of what I also try to do in just in the movement side and not the nutrition side as well, of how do we get people to change? How do we help with habits. But those are the general trends. And what we're going to talk about is trying to address those trends specifically.
Yeah. So what are some important guidelines to know for nutrition? Like protein, carbs, fats, all of that.
And I think that's kind of the easiest for a lot of people is protein, fats, and carbs. Protein being probably one of the most important ones for us and one of the most justifiable ones for us, given that we can say, hey, protein is the thing that's going to rebuild muscle tissue. And in general, if we're going to talk later about inflammation, probably the idea of what do we need in order to have our patients get better faster. So with protein, a lot of therapists tend to think, in my experience, this is purely in my experience, that people are not eating enough protein and people need to be eating more protein. There is a lot of, in the fitness industry, there is this constant talk about more protein, taking a lot of protein. The number that's thrown around a lot is you need to get a gram of protein per pound of body weight, which is a crazy amount of protein. But I'll tell you where it comes from. So there was a study published a while back in the International Nutrition Sport Nutrition Journal, and they effectively said that in their research for elite athletes, they required anywhere from 0.8 to 2 grams of protein per kilogram of body weight. Now, to help people with the whole metric and transitioning side to things, kilogram is about 2.2 pounds, which then transitioned to, it was about 0.36 grams to 0.9 grams per pound. So we round that up to 1 gram. But that all came out from the top of the elite athletes should be consuming 1 gram per pound of body weight. So if you're having normal individuals that aren't having that much muscular tissue breakdown and need of recovery consuming that much, you're overloading the system with a lot of protein. So really we should be looking at, and we'll talk about the exact sort of percentages that are best, but fine, even if they're working out and they're doing some sort of exercise, 1/3 of their body weight is still an adequate amount of protein. When it comes to surgery, though the easy rule of thumb is 1 gram for 2 pounds of body weight, usually after surgery. And then depending on if the surgeon ever even tells the patient that, but you can talk to the surgeon and after a while, they may be okay with you going down to 1 gram per 3 pounds, which is once again, that third. Really, a lot of it has to do with also the quality of protein, which we're going to talk about later, and what different things can cause inflammation, because you might be consuming a lot of protein, but if you're causing a lot of inflammation in the body, that's not even going to be necessarily helping you recover from the surgery, whatever it may be. So for general people, the bottom line is about 10%-ish is going to be protein. Recent guidelines, they're kind of starting to go up in how much you need out of that, but 10% is the bottom line, sort of across the board for adults, is 10% protein. When it comes down to fats, it seems about 20-25% of our calories should be coming from fats. And then the rest, which is anywhere from 60 to maybe 75%, is carbohydrates. We will talk about the kinds of carbohydrates and why you should choose the various things as well. But that's sort of your general thing. It tends to be that a lot of meals are focused around increased protein and increased fats. So we're overeating the fats and the proteins. And then the carbs, may not be surprising, are coming from a lot of sugars. So that's not helping otherwise. But that's the general outline. I don't know if there are any specific questions that I missed out on that.
No, I think as we talked a little bit more about it, it's going to be more clear, I guess. So what to know about nutrition and inflammation that you just mentioned about inflammation now, and then osteoporosis and obesity.
Right. So we'll go through them. And I kind of picked out the inflammation, osteoporosis, and obesity was going to be more of a combination of heart disease and diabetes as far as what we're treating. I think these explain the rationale for what foods we need to be picking. And on top of that, they are absolutely pertaining to physical therapy. So inflammation is a huge thing that we have to deal with, because if tissues aren't recovering well, you may be doing all the mobilizations and exercises you want, but it's still going to slow down the overall process. So what foods increase inflammation? Not terribly surprising. Sodas, refined carbohydrates, refined oils. But on top of that, red meat and processed meats. So this is where I tend to get a lot of the hate, is when I talk about meat and all these things. But through research, everything that I'm going to talk about, all of these things, my goal is to present the evidence, and then you make the decisions for yourself. I have made my decisions, but I'm here just to present the evidence. So
fair enough.
Processed meats are now in a group 2 carcinogens, which is the same group as tobacco and plutonium. This gets blown way out of proportion because people are like, when you eat bacon, it's like eating plutonium. No. All it's saying is that processed meats have shown a direct link to cancer. That's all that that's saying. Red meats are in group 1. All that is that there is a high likelihood, but we haven't found a direct thing. That's what the evidence says. Make your own decisions. I'm not here to preach anything more than that. So we have these foods, we have these refined sugars, we have these sodas that patients are consistently drinking. They're increasing inflammation. What foods are going to decrease inflammation? Not surprisingly, fruits and vegetables are great at decreasing inflammation, especially those that are high in antioxidants and something called polyphenols. We're not going to get too much into that. Basically, colors. Foods that have a lot of different colors and all these things is a great way to talk to patients and say, hey, are you eating different colors? So if you're only ever eating strawberries and you're thinking, hey, I'm doing great as far as antioxidants, you're doing better than many people, but you could do other colors as well. There's plenty of things. And eating around the season is something that people talk about very frequently, is what is the fruit or vegetable that's in season. On top of that, as far as antioxidants and all that is concerned, fatty fish is going to be pretty good for you. And that tends to be more of the higher quality of fish. So tilapia is usually way down there. Like fish sticks and getting a filet of fish at McDonald's, that doesn't really count as fatty fish. I'm sorry, it doesn't. And then nuts. Nuts are also a great source of a lot of because it really packs a lot of good nutrients into those things as far as decreasing inflammation. So fruits and vegetables, fatty fish, and nuts seem to be great at improving all of that. Now, when we're talking to patients about some of these things, especially sodas, it's incredible how much you can improve, because soda, on top of that, you're talking about caffeine and things like that. If you're improving patients' sleep, you're also improving their recovery. And sometimes you can be doing all the exercises again and all these things, but it's just not hitting the mark. They're not improving the way that you want them to. And so nutrition can be that extra level that you can kind of push a little bit further. So that's in terms of inflammation and sort of systemic inflammation, which we'll touch up again, and diabetes, because obesity is also argumentatively just systemic inflammation for a while. But let's go to osteoporosis now. So osteoporosis is another thing. Bone health is something we care about, especially in the older population, bone mineral density. And we always come across this idea of calcium. So here's where we get into this interesting thing. When people talk about calcium and how to get more calcium, what I tend to hear and see is that three things are usually offered in terms of diet and calcium: milk, unsurprisingly, fortified cereals, and just calcium fortified foods, which is basically where something didn't have calcium and they added calcium into it. And then usually just calcium supplements of some sort of variety. So it seems that increased calcium consumption through studies, increased milk consumption leads to increased mortality and increased hip fracture rate. It was increased hip fracture rate in women. In men, it was unchanged. But increased consumption didn't improve their fracture rate. It just stayed the same. It increased mortality across the board. So in terms of milk, maybe not necessarily the best. And it's been seen a lot that if you generally look at countries that have the highest dairy and milk consumption, they also have the highest prevalences of fractures, osteoporosis as well.
That's interesting.
Yeah, and it's some more of the European countries that have that. So that kind of leads us to think, okay, maybe the whole idea of drinking milk isn't the best, but why? We don't want to just harp on it. And this is where we're really going to get into some of the more scientific sides of things. So listeners, stay with me.
I'm curious to hear about the milk now. Yeah.
Yeah. But it's interesting. So why does this happen? So the interesting thing, we'll talk about two parts. Milk, a lot of people have dairy allergies, lactose intolerances, and dairy seems to be very inflammatory. In general, for a lot of gut issues, dietitians usually tell people to stay away from dairy in general. It's inflammatory. It also increases acidity for us in our blood. And that is important as well. We're going to find out here in a little bit. Acidity meaning lower pH, meaning increased percentage of little hydrogen ions throughout the blood. So what was found, also milk obviously increased amount of protein. It was found that basically for a 40 gram increase in protein, there was a 50 milligram increase in excretion of calcium through urine. So basically we peed out more urine and didn't, more calcium, and we didn't maintain as much calcium as we took in more protein. So dairy or not dairy didn't matter, more protein, less calcium that is left with us. So the question is, well, why? 90% of calcium that was ingested was basically excreted out through urine if the pH of the blood was too low. So you may be taking in all of the great fortified cereals, all of that wonderful milk, but if the milk causes inflammation and which causes increased acidity, if the increased sugar in the cereal does the same thing, you're getting rid of 90% of that calcium and it's not going into your bones. Why, right? That's the question is, why don't we absorb it? So this is where it gets really fun and interesting, and I'm going to nerd out on everybody here. So there is a molecule. We talk about calcium a lot, but phosphorus is another part that's very important to it. Calcium is stored in bones. 99% of our calcium is in our bones, and it is stored as basically calcium, phosphorus, and some oxygen and hydrogen in a giant, giant molecule. In order for us to reduce the pH or the acidity to improve the pH of our blood, our body takes the calcium and phosphorus out of the bones, breaks it apart so that the calcium and everything can bind properly to all the hydrogens, and then we excrete all the calcium that we don't use. And so this process happens if our pH is too low. If you add in a bunch of calcium into that by drinking milk or anything else, your body's going, we don't need that right now. We're taking calcium out of the bones. We're not putting any in. No, thank you. Please get rid of that. And so 90% of it goes out. So the part that we need to address is, how do we make sure that pH stays the same? But on top of this, what's the right ratio of the calcium and the phosphorus? Because in our bones, in that molecule, the ratio is about 2 to 1. Technically, it's 2.2 to 1, but it's about twice as much calcium as there is phosphorus. In cow milk and a lot of dairy milks, it is about 1.2 or 1.5 to 1. So it's not quite enough calcium, actually. In human milk, it turns out it's perfect. It's about 2 to 1. So human milk is fine, and that makes perfect sense. So what foods have a good ratio and what foods don't increase acidity so that we're able to actually absorb the calcium into the bones? Leafy greens, it turns out. So things like turnip greens, kale, spinach, all of these things have an alkalizing effect on the blood, so they don't make it acidic, and they have a great ratio. And you can even just Google the calcium to phosphorus ratio, and there's a huge list of foods that, and then you look, it's all the vegetables, berries, things like that. They give you the good ratios. So that essentially tells us we should probably eat more leafy greens, which isn't surprising. We all know that, but it gives you a better idea of why. As an added benefit, vitamin D helps us absorb even more of it, because unfortunately, we're kind of fighting ourselves when it comes to calcium because our gut isn't really great at absorbing calcium. The numbers are something like 15 to 20% only of the calcium we ingest, we can even take in through our gut. So you're already at a disadvantage. Then you add in the acidity, the inflammation. No wonder we're seeing so much of the osteoporosis, things like that. And so the bottom line is, I'm not saying take out dairy, but understand what dairy might be doing and what these inflammatory things might be doing. and know that sources of calcium are actually going to be more of those leafy greens that are going to be a better source of calcium. Truthfully, leafy greens have a crazy amount of protein in them as well. The problem is they don't have a lot of calories. But if you go protein to calories, leafy greens have more protein than meat technically does, and beans. The problem is you have to eat so much of it that there's just no way that you can keep it up. But you'd be surprised how much, like spinach is 50% protein if we look at calories. So, but you have to eat lots of spinach, and nobody's going to do that. About all of it. But that was a lot of rambling. Did I miss anything? Did any of that get really confusing and weird?
No, I think I was following you, and it was just very surprising to hear about the milk, because I mean, I'm the one that has allergy, so I don't drink much. I can't at all. But I didn't know that the general population was causing inflammation. So that was something new for me. That was crazy to think about that.
Mm-hmm.
That most people probably think, yeah, let's drink milk, increase our calcium and all of that you just said. And then to hear that increase the number of fractures, like on the population and women, that was crazy.
Yep. And that's, it's interesting. Absolutely.
And I heard about before the pH of our body, how that's important, but I didn't know that, for example, milk would make your body be more acid, right?
Mm-hmm.
Increase the acidity. So that was also something new for me.
And the thing about it is it's such a fine line as far as our pH. Our blood pH really doesn't move a whole lot. So even those small changes they end up having a big impact. Now, so that people don't think I'm somehow against milk, that study of the increased fractures, they basically looked at, I believe it was glasses of milk throughout the day, and they went from 0 to up to 3 glasses of milk throughout the day. So obviously, as you went up, it increased. So if you drink 1 glass of milk, it's not as if you're doing this awful, crazy thing to you, but just understand what it is doing, and just make your own kind of ideas and deductions from
I think it's just balancing as well. We are not going to drink 3 glasses of milk every day. So, I mean,
right.
I assume, I don't know. I
have had patients that do that. I've had patients that say, no, really? Like I'm on it. I drink 3 glasses of milk a day. And I used to think that was good. Okay, all right, that's good. And now I'm realizing, oh, hold on. It's not necessarily something they get.
And maybe people do this because that's what they think, that it's going to be good. So I'm going to kind of not force myself to drink, but like, okay, I like milk, so let's drink more a day because it's going to be good for my bones, right?
Right. So, but unfortunately, that's not the case, seemingly. The interesting thing, there was some speculation about how does calcium affect muscles, because calcium ions are used in muscle contraction. But it doesn't seem that there's a huge effect in that regard. So if you ever have people thinking, oh, I need to drink calcium, I need to take in calcium for muscles, just so you guys know, it's primarily bones that it ends up impacting, because that's kind of been looked at. But more research needs to be done in that regard.
Yeah. And I have a question about almond milk. Have you heard anything about the almond milk? How would that be impacting calcium or?
Sure. It is better because it's not quite as inflammatory. Here's the catch with almond milk. Unfortunately, though, almond milk is still inflammatory most of the time, unless you make your own, because they put in a bunch of additives and other things. So it is still processed foods. Is it better than regular milk? Yes. Is it all around just good? You could probably do even better than that. But yeah, that's about where it is. But it does have good calcium.
Okay. And all of this about milk, do you think that it has anything to do with the milk being so, like with all these things that they put on the milk to keep it like just, because I remember like when I was a kid, my mom would buy, in Brazil it was different because we have these packages of milk. You have to keep it refrigerated, and in 2-3 days would go bad. So we would warm up to see if it was still good, the milk. And just, I feel now it's different. I don't know if it's because of the amount of conservatives and stuff in the milk. Do you think there is anything to do with that? That maybe the natural milk, if you would think, it wouldn't be as inflammatory as the ones with conservatives and stuff?
Absolutely. And this is actually true for milk, and I would say true for meats and all across the board. Unfortunately, the majority of our patients are not eating, grass-fed beef and free-range eggs and milk straight from it. We went up to New York, and my brother loves getting, if we stay near a farm, he loves to go and see if he can just get milk straight from the cow, like if he can ask the farmer to just give it to them. And a lot of times, because it's technically illegal, like they could get sued for it, he ends up getting it anyway, but that would arguably be better. However, because milk, after they get it, it goes through a whole process. I don't really want to discuss, there's an amount of pus that is supposed to be allowed inside milk. That is okay. If you really want to never drink milk again, you can research that. But yes, there's so many antibiotics that go into the animals. There's so much that goes into it that, yeah, if you're looking at the mass-produced animal products, they're usually more processed than we think. So even just the ground beef or the chicken, there's so much antibiotics and things in there, even though it is just the meat. It's more processed than we think. And it's really those things that we're concerned with before, when we talked about inflammation and carcinogenic. When you're looking at more of these grass-fed and more organic kind of stuff, it's going to be better, and they have better nutritional profiles as well.
But even if it is healthier and all of that, it's not something that's like doable for the vast majority of population. So there is not no really point of discussing. Not that doesn't matter, but who is going to get access to that anyways? So it's hard. There's no way that we can. And
that's where usually I don't, and I'll talk about kind of, I might as well drop it in here. I don't like when people go, say like the vegan diet, and people use the word vegan, because then immediately patients go and they lock up. The way that I tend to discuss it with patients is I like using the term plant-based diet. And nowadays, plant-based means 100% plants, no animal products. That's not how I take to mean it. I take to mean it like this. Most of the times when we talk about food and you ask a patient, what are you having for dinner? Or what did you have last night? We base it around meat. People will go, I had chicken and rice. I had steak and potatoes. The base is the meat, whatever it is. And people even truncate it to that. They'll go like, I'm thinking, chicken. I'm thinking fish for dinner. It's whatever the meat is. All I tell patients is I'm like, eat your meat, like do whatever, but do me a favor and switch your perspective and base it off of your vegetables, off of the fruits and vegetables that we know you should be eating. So instead say, I'm going to have rice for dinner, or I'm going to have potatoes for dinner with some chicken. And as you have them shift that slowly, the amount of that inflammatory food that they're going to be eating hopefully is going to decrease as you're shifting that perspective of let's include those antioxidants, fruits and vegetables in there as well. So, but that's on the side of how to talk to patients about it and things like that.
And about the obesity, you're going to say something more specific about it?
Well, about obesity, and really it's kind of a combination of diabetes, heart disease, cardiovascular disease, and obesity altogether. So all of these things that I'm talking about, in the end, they will sum up to sort of what did I conclude from the research was sort of like the ideal diet. I hate using that. I put it in quotes because really there's no ideal for any person. It's always going to vary a little bit. But in general, it was found that high carbohydrate diets were good for diabetics. They improved insulin sensitivity and overall across the board, which seems counterintuitive.
Yeah.
Because you go, wait, diabetes, don't do sugar. Sugar and all that is bad. Here's the catch. It turns out that as long as you include a proper amount of fiber, which we're generally under eating fiber by a lot, and a lot of the processed foods don't have fiber, animal products don't have fiber. If you include fiber with the high carbohydrate diet, you improve insulin sensitivity, as well as a lot of the markers for heart disease. So HDL, LDL ratio improves, a lot of the triglycerides, all the wonderful stuff, it improves. And interestingly enough, especially if you reduce the amount of trans and saturated fats. So these are all the fats that are, the easy way is they're solid at room temperature. So any kind of lard, any kind of butters, all those things, if they're generally solid at room temperature, if you tend to exclude those and include more of the, olive oils, avocado oils, things like that, you also improve the lipid profile of people. And that profile is improved 2 to 2.5 times more in specifically diabetics. So all of that to say that if you're maintaining good fats, so we said like fatty fish, nuts, if you're making sure there's plenty of fiber that you're including into the diet, leafy greens, fruits and vegetables, all of these things have plenty of fiber. That is going to improve diabetes. That is going to improve calcium retention, and that's going to improve inflammation. All of these things are going to be benefited from it. So as long as you're maintaining this idea of the ratios of the nutrients that we said, which was about 10 to 15% protein, 15 to 30% fats, and then 60 to 75% carbs, which the reason those are ranges is because it's just going to change for, if you're an athlete, you're going to need a little bit more protein. But then fats are just going to be determined on how well you can work with carbs. And if you're getting to the point where you're having these in-depth discussions with your patient where you're saying, hey, let's tweak your carbs a little bit, let's talk about your fats a little bit, that's probably a time to refer them out. This is more of a general guideline. If you're having somebody coming in and you have them just, hey, can you do a little food diary for me and just look at how much of this stuff you're eating? And you find out they're eating 40% fats, 30% protein, and some carbs, you're going, okay, obviously you need to shift some things here. But that's where it just gives you an idea of what's right and what do we need to kind of move towards in regards to all that.
So on the diabetes, you said like not the key, but it's the important thing is make sure that they are eating fiber, right?
Yeah, make sure that they're eating fiber. And usually, so this is a resource, and I'll mention it again at the end, but honestly, health.gov is a great resource. We sometimes tend to think that, a lot of the government things don't have a lot of information on them, but their guidelines for healthy eating it's a vast document. It's about 140 pages plus. And they've really been progressing it, and it gives you a lot of good starter information, and it's a great resource for patients as well. And so that way they can get a little bit more educated about it, and you can sort of proceed with that. So their percentages are a little bit different in that sense, but they're going up to somewhere of around 30 grams of fiber is what we need. Our trends is about 15. People are usually doing about half of that. So huge underconsumption of fiber in general.
So as I hear you saying about the grams and percentages of like how much fat and protein. So in practical terms, how you're going to know that, like talking to your patient, because, okay, we know the theory, the percentage, the grams, but like how you're going to translate that to practical terms.
Perfect question. And this is where I also go, we as physical therapists deal with a lot of numbers all the time that we don't ever say to patients. And sometimes we do, you measure knee range of motion after a total knee replacement and you're like, hey, you're almost at zero. You almost got full extension. We're almost there. So it's important for us to know the numbers. You don't necessarily have to overburden the patient with numbers unless that's something that they're asking for. A lot of times you can usually get a good assessment of how much of anything that they're generally eating. And once again, I'll say, if you go to that resource of the health.gov, they'll give you small portion sizes of how much it should be. And if you just go, hey, can you tell me what you're eating throughout the day? In general, we know that if we're hearing that they're having animal products for all 3 meals, or if they're eating more than 3 meals and they're consistently doing that, it's telling you they're likely over-consuming in protein. It's telling you that they're likely overly inflamed. If they're telling you that they're drinking sodas and that they're not intaking enough water, and that there's a lot of sugar and snacks that they're having, like chips or candy, that tells you there's an increased amount of inflammation most likely, and all of those things are going to affect the acidity of the blood. So you're thinking, okay, if calcium absorption is an issue. Most of our patients, that's not something we really think about that often, but if it is. But you're thinking about that and thinking about decreasing inflammation. So you're going more along those trends. Now, how do you have these discussions with patients? Okay, this is a specific patient. So this is from experience. I had a patient come in, couldn't sleep, wasn't sleeping very well at all. And we couldn't figure it out, wasn't recovering, had some pain. Pain didn't seem to respond, low back pain. And then at one point came in with a big gulp, which is like 32 ounces, maybe it's like 48 ounces, something ridiculous, one of those ridiculous size things. Turns out drinking 3 big gulps of Mountain Dew every day and pretty much no water. Now, one would think, okay, we have to tell them absolutely stop drinking all soda and drink water. That's never going to happen. We have to be realistic about it. So what we actually did is I said, can you drink half of a big gulp of water? Just add that. And then slowly we said, okay, full big gulp of water. And then we took out one of the ones of soda. So we're just slowly transitioning. It's a slow shift. And with one big gulp of water, pain at night went away completely. It was just water. At the end, we didn't get to know Mountain Dew. It was 1 big gulp of Mountain Dew and 2 big gulps of water. That is also just a habit that the patient had, right? The patient liked drinking from a giant cup with a straw. So instead of saying, get a water bottle, get anything like that, that's new habits they have to teach. So it's working within their sort of ability. It's the same thing with foods. If somebody's going, yeah, I'm really making sure I'm drinking all my milk for calcium, or I'm making sure that my protein intake is nice and high, saying, have you thought about leafy greens? And if they're like, that's no protein in that. Well, actually, there's more protein in that than what you're doing. And then just look into that. And then it's better for your calcium. So it's these small shifts when we talk to patients that we're noticing, as opposed to telling them you're restructuring your entire diet and changing completely, because it's a process.
It's more like a guidance on like what you should do and avoid and try to increase, as you said, in general terms. So it makes sense.
Right.
And I have a question about the vitamin D that we were talking, that you said that helps to absorb calcium, right?
Mm-hmm.
And the vitamin D, do you mean taking supplements? Because I think most people with this pandemic, we've been hearing a lot about vitamin D and finding out that most people are with deficient, but like with low levels of vitamin D. So just to clarify on that topic. So what do you mean by vitamin D? Vitamin D?
Sure. Most people are deficient in vitamin D. That's true. Pre-pandemic, during, post, most people are. They even did some research on skateboarders in California, some kids that were skateboarding in California. So they're getting a lot of sun, which is how we generally make vitamin D, and they were deficient in vitamin D. So here are a couple things about it. One, if you have a patient that's getting their physical, usually if they're getting any kind of blood work, vitamin D a lot of times is tested, and that's usually something that they can see and they can ask their primary care. It is pretty safe to assume that they're deficient in vitamin D most of the time. And you can't, if you supplement with vitamin D and get plenty of sunlight, it's not like you're going to overdo vitamin D. So supplementation with vitamin D is usually a good idea. When it comes to going outside and getting your dose of vitamin D, skin is going to be a great way for us to take in vitamin D. It's getting colder here now, so most likely you're going to be bundled up. So here's the other catch. We develop vitamin D because it's called vitamin D, but it's technically a hormone of how it works. We also generate it if we get sunlight through our eyes. So if when you go outside, you're always wearing sunglasses, you're depriving yourself of some of that vitamin D. This doesn't mean stop wearing sunglasses, but it means that sometimes allowing yourself to get some of that sunlight into your eyes will also help you generate and get some of that vitamin D. But supplementation is it's a good way to go. It's very simple. They're small, tiny little pills, and you don't even have to take them. You could take one once a week. It's nothing crazy or difficult to do.
Yeah. It's interesting because we did that on the physical. We test vitamin D, and me and my husband, we were deficient. And in that time, we just came back from Brazil from summer. We got plenty of sun. So we were like, how can we be deficient? We just got tons. Like, when are we not going to be deficient? Because if you're, after all this sun and still deficient. So that was something very interesting that we just paid attention for the first time because people start talking more about it because of the pandemic. So we were like, that's different. That's something. Yeah.
And I wonder, and this is not something that I know for sure, but I wonder if in general, we are spending, if we talk about evolution, we're spending a lot more time indoors. We used to be outside all the time. So our bodies are not as efficient at generating and creating vitamin D, even though the input from the sun is there. So that I'm wondering if that is also a big part of it, because it's sort of what we talked about with diabetes and that. The interesting part is people think, don't give them sugar, don't give them all the glucose. But truly, as you give them more, the body goes, oh, I need to get better at using insulin to digest this. And that's why it seems that the high carbohydrate diets did better. There may be a similar mechanism here of we are not efficient at producing vitamin D because usually we spend all time indoors. So even if we're out in the sun, our body goes, I don't know what to do with this. I haven't done this for a while.
Yeah.
So.
It makes sense. When you said once a week, taking vitamin D should be enough. So you don't have to take every day the supplement.
It depends on what supplement you get, because a lot of them, there's different units, and it's not measured in milligrams, it's measured in units. And because there's some that are like 3,000 units. And you can take one of those. You don't need to consistently be doing that. And so it depends on which supplement you get. And this is where I go, if you're getting way too into the numbers, that may be a time to refer out, because you may take some amount of the supplement, but you don't know what that did to your actual vitamin D level. So the best thing to do is take that supplement, and you're not going to overdose if you take like 10,000 units all of a sudden. It's nothing that drastic. What does that do? Go a month, go 2 months later. Can you get another physical? What did your vitamin D level do? If it's skyrocketed and it's through the roof, you can go down. Maybe you don't need to take it as frequently. If you're only taking it once a week and all of a sudden it's not. So, and that's where we have to play around with it a little bit more, because that's a lifelong thing. And sometimes we don't see patients for that long, especially if we talk about getting patients better in 4 or 5 visits, and something that we strive for to get them better faster so that they're own advocate and they know how to get themselves better. You may not have that interaction with them quite as often. Still more often than the doctors though.
Yeah. Yep. But as you said, it's just more like general advice, right?
Correct. One other piece that's just coming to me that we didn't touch on, that is unrelated to all of those things that I said, is magnesium and potassium. And this is just to help people out, because as a student, I ended up doing a little in-service on this because we had a debate in the clinic about it. So obviously for us, when patients come in and they talk about cramping and muscles cramping, yes, sure, soft tissue mobilization can be a good thing that can sometimes help with that. But inevitably we go, how's your water intake? That's the first part. If they're not drinking enough water, it's probably water. And then the second, people always go, oh, it's just potassium. You should just eat bananas and you'll be better. So the interesting thing is potassium and magnesium, both deficiencies in both can cause cramps. They're different kinds of cramping of the muscle. Potassium is cramping while using the muscle. So you're thinking about runners or somebody while exercising, they cramp up. That could also just be weakness of the muscle, could be potassium. If they're waking up in the middle of the night, far, far more likely that is a deficiency in magnesium. And the way I remember it is midnight magnesium. They both start with M. That's how I think about it. So if they're waking up in the middle of the night at midnight, that's probably magnesium. Most people will say, just drink a Gatorade and you'll be fine. Oddly enough, Gatorade does have potassium, but no magnesium. Powerade has magnesium, but no potassium. I don't know why. I don't know if their formulas were somehow addressed that way, but if you look on the back of the label, it actually says it on there. It says magnesium, it says potassium, and how much they have. There is a drink called Nuun, N-U-U-N. It's a little powder. It has both, and that's an easy way for patients to get both. And that seems to be the overarching recommendation of, if you do that one as your drink of choice to get the right electrolytes, that's the one to go with.
I had a patient that she usually says that she drinks tonic water for cramps. Mm-hmm. She says it helps.
And I don't know for her if that is, and there might be salt in the specific tonic water that she gets, because some even mineral waters and things, they have salts in there. So it can definitely help. But yeah, it depends on what's in the specific tonic water.
Yeah, I know she keeps like on her refrigerator, and sometimes when she's like doing exercise or something, she's like, hold on, I have to get my tonic water.
That's awesome that she knows that it helps. That's perfect.
Yeah. Yeah. Okay, that's good to know. And where do you buy this liquid? Like in any store or something?
Yeah,
specific?
Noon is anywhere. Most grocery stores are going to have it. You can get it online. I think they now sell it where you can actually buy the liquid, but also usually I just tell patients to get it in packets because then it lasts longer, because then you don't necessarily need the whole packet always. You can use half a packet or a little bit and drink it throughout the day as you mix it into the water. And then usually if they do it that way, they end up drinking more water as opposed to if they drink Gatorade or Powerade, it ends up being far more sugar in that stuff. And so that's the other reason to kind of push them away from it.
Awesome. That's good to know. Before we transition to the final questions, do you have anything else to add or anything that you want to say about what we just talked?
No, I think that was a lot.
Yeah, it was. Just like when we've been talking for 1 hour, the time is just like, I hope that people are still with us here.
Yes.
So what is your favorite resource of information? Any books or anything specific that you like?
Sure. Once again, health.gov for those wonderful things. If you want to get really, really into all the crazy nutrition things, nutritionfacts.org is awesome. And they do a lot of things in video. So if you want to just kind of put it on, and they usually go through research studies for that. So it's easier than you having to read a bunch of research studies. And I'm giving you sort of nutrition specific things because all the other guests give you wonderful things in terms of physical therapy. And those are all great ideas. Now, the health.gov is a great place to start for you and your patients because it's a very, very basic resources, but they also give a lot of references if you want to dive deep. On a completely shifted side of things, because I think it's something important to talk about, the book Atomic Habits has kind of been thrown around for a lot of people. And if none of you have read it, possibly you need to read it. I hope that some of the people listening have. It basically talks about ways for us to improve our habits, help other people improve their habits, and how we should look about it. This can be used in terms of improving patients with their HEP. It could be talking about nutrition, whatever else it may be. But understanding how we can improve our own habits and help patients improve habits is so powerful because we know what they need to do, but we need to help them get to the point of actually doing it and finding that motivation. What I will say is that I think that that sometimes might be lacking for people is we go, I don't want to read that research study. I don't want to do that. Yeah, I know I should, but I don't want to. That book will help you get into the routine of possibly reading a case study every week or whenever so that you can develop that. Because if you don't make it a habit, getting into all this extra research and all this stuff, it's not going to happen. You have a great forum of this podcast that you're constantly getting new information in from people and you're learning all this awesome stuff. And people listening to it also are getting this stuff. So getting into the habit of getting this information, that book is going to help you get there.
Awesome. And what would be the best advice you give to clinicians that are starting their careers?
So this is something I've thought about, and I'm going to go a step before, and even students that you're about to go into it, if you're possibly listening to this, but if you're starting out, it's going to be okay. You're going to be fine. It'll be great. Be you a new clinician or a student. Sure, you're going to mess up and there are going to be mistakes. That's okay. We tend to try to, especially after PT school, a lot of people want to be perfectionists and we want to be perfect as new clinicians and we can't possibly mess up. And we beat ourselves up about the fact that we made a patient feel a little bit worse. Learn from it. And there are plenty of other guests that have said this before. If you did a manual technique and the patient felt worse, learn from that. That actually tells you something. That's not, oh no, that's bad, I'm never doing that again. That tells you a piece of information. So learn from each piece of information, but don't overanalyze because burnout is very real in our field. And I think if we push ourselves too much, that's kind of what happened to me in many regards, because I was pushing myself too much with documentation and being blind. That wasn't very fun. So my thing is, make sure that, yes, you want to be the best clinician that you can be, but go at the pace that you want to go at, and failure is perfectly fine. Just learn from it.
Yeah, that's very true. And what personal qualities or abilities that you think are important to become a successful physical therapist?
Be authentic, be yourself. That's part of the reason I'm even talking here about nutrition, is because even getting into physical therapy, I've always been bringing other parts of myself into it. I love making videos and I love being a teacher. So I loved always presenting and showing things to patients, because that was just part of me. Does every therapist have to do it that way? No, but that's what felt natural to me. And so bringing that in to your own practice. The reason patients come to you is not because you're the best, it's because you're the best for them, most likely, right? That's where your repeat patients are going to happen. And so if you're thinking that I'm going to be the best physical therapist there ever was, that's impossible. You're going to be the best physical therapist that you can be, and that's awesome. And you're going to find your niche, and that's exactly what is important. So I think it's the qualities of bringing your own little personal things into it.
Yep. Yep. And I think that's important, because sometimes, as you said, we beat ourselves up because we want to do the best and figure it out every single case, and have all the tools to solve all the problems. And it's not as simple like that. Mm-hmm. And for people that want to learn more about you or wanted to contact you, do you have any contact info that you want to give us?
Sure. You can find me on LinkedIn, Stefan Zavalin, Stefan.Zavalin on Instagram. There, I'm not really doing as much of this like nutrition stuff. It's more of putting it out about company culture and getting people moving and that sort of regard. And then feel free to contact me. If you go to the website, ltmmtl.com, that's my website, and there'll be plenty of contact ways there. I love questions about anything and everything, and I will totally nerd out about nutrition or any physical therapy stuff. So if people want to reach out, I love it.
Awesome. I really appreciate you sharing all your nutrition knowledge with us. That was very interesting. I learned a lot of different and new things that I didn't know. So I hope that's going to help a lot of other PTs to have these conversations with their patients. And even about the fact of the APTA that it says about nutrition, that was something new for me. I had no idea. When we first talked and you suggest nutrition, I was like, that's going to be interesting, because that's not something that we commonly talk about. So it was very great. Yeah, it was awesome to learn about these things and just have a general idea so we can help our patients and improve our care overall. So I really appreciate it.
Yeah, it was my pleasure. And again, to those listening, take the big takeaways. You can re-listen later for the really in-depth stuff. Don't feel like you're being overburdened with all this.
Yeah, absolutely. Thank you.
Bye.